greetings to all watching and listening to this episode of Chezuba Talks. I'm Tej, and with me today is Martha Day. She is the co founder and secretary of the Vitamin Bridge. It's a nonprofit. And what does it do? It is well documented that early prenatal care, including prenatal vitamins, can decrease the incidence of preterm birth, low birth weight, birth defects, and improve the overall health and outcomes in pregnancy. But how does an underserved pregnant woman get access to these crucial medications? Martha is here to tell us exactly that. Welcome to Chezuba Talks, Martha.
Thank you, Tej. Thank you for the opportunity to share more about what the Vitamin Bridge is doing to help under-resourced moms to a better start.
You know what? The first thought that came to me when I looked up your website was that this is a very, very niche service that you are providing. How did you, first and foremost, congratulations. Thank you for telling me that it's 5 years since you have, started this nonprofit and 100,000 bottles have been donated. Congratulations.
Thank you.
So I was talking about how this is a niche service area. And how did you start this?
I was actually serving as a volunteer at a local organization that serves under-resourced women early in pregnancy. I became aware of the situation as I observed and listened. The women would receive the news that they were pregnant, a positive pregnancy test, and when asked if they were taking a prenatal vitamin, the answer was almost always no. These women were coming for free services. They lacked insurance, a doctor, oftentimes lacked financial resources, maybe transportation, these type of struggles. And then they were told, you should stop on your way home and get a bottle of prenatal vitamins. It's important to start them as early as possible, as soon as possible. But it just seemed to me that it was an excellent opportunity that was being overlooked. At the moment, the day they find out they're pregnant, why weren't we just giving them a bottle of prenatal vitamins to get them started, to give them an example and to ease one burden or stress? These moms, if they are struggling to have enough to eat, to take care of their children, to put gas in the car, were they going to stop on their way home and get a bottle of prenatal vitamins? They were likely going to stay on the shelf. But we have no doubt about the value and the importance of those moms, especially those moms receiving vitamins early in their pregnancy.
Right. And how did you come to the decision of, a particular brand of vitamins or a particular, number of vitamins, number of capsules? How did you come to this decision? Was it some consultation?
So, you would think, or initially I thought, well, how hard could it be to just get enough vitamins so that everyone that came to this organization, this particular location where I was volunteering, so that everyone would have a bottle that needed it. Sometimes they would have vitamins that had been donated and the most needy would receive those, but it just seemed like everybody would benefit. So we started out trying to just raise some funds, buy some vitamins so that everyone at this one place would receive them. It's a little harder than you would think because you go to a pharmacy or a grocery store and how many bottles are on the shelf of any particular brand? And there's a huge variety of brands and quantities and gummies and capsules and tablets. So we started trying to buy 100 bottles. And that's not that easy. Just to buy 100, even if you go online, they're going to limit you to, say, 12 bottles. So we ended up reaching out to CVS Health. They routed us around to our local store, who the store manager appreciated what we were trying to do. And so he worked with his distribution coordinator to be able to get 100 bottles. And we were thrilled. We were able to purchase 100 bottles and donate those. But you know what? As soon as we had done that, they needed another 100 bottles. And so the cycle began where we bought 100, donated 100. A couple of weeks later, we bought another 100, donated that 100. And then we started finding out about other organizations that were seeing the same situation and wanted to participate too. And so it has just grown organically from that first 100. We were so excited when we delivered success 100 bottles, and the need is great, and the opportunities are tremendous. So we just keep, as we have the financial resources to buy more and more vitamins, that's exactly what we do.
And this is a one-time service, right? I mean, one mother to be will get one bottle of, not the entire duration, not the 9 months of supply.
Generally speaking, that's correct. The idea is the bottles that we're donating have a 100-day supply, which will get the moms through a trimester. Most of these moms are going to go on to apply for and receive Medicaid, and Medicaid will cover prenatal vitamins. So we are trying to bridge that gap. Thus the name Vitamin Bridge. We're trying to bridge
Ah,
that
okay, got
gap
it.
from the day they find out they're pregnant to the time when they have Medicaid coverage to provide their vitamins. That's 100 days, but it's a very critical 100 days early in their pregnancy that
True.
so much is going on for mom and baby. It's just a great time to have that added nutrition and to set the example. They have something to model after. What which
Hmm.
prenatal vitamin, a prenatal vitamin, what does it contain, and how do you take it? So those are the things that we're accomplishing with that donation.
Let's take a break to understand what Chezuba is. Everyone at some point ponders on how this beautiful life can be made more meaningful. Maybe you're a leader trying to enhance your employees' experience at your organization. Or you already work for the community and seek volunteers with state of the art skills to strengthen your nonprofit. Whatever your situation, know that you can make a difference. Chezuba began with this very vision, a vision to facilitate every skill and every passion in the world in meeting a social need. Corporate volunteering has several benefits for both businesses and organizations. In parallel, experienced and enthusiastic volunteers join NGO workers, enabling them to serve the community more effectively. Chezuba offers everyone looking to add purpose and meaning to their lives a chance to connect or volunteer virtually with nonprofit organizations from over 100 countries around the world. Visit www.chezuba.net and explore opportunities to find meaning. Chezuba, your platform to do good. And now, back with our guest. Lovely, lovely. So you've thought of this entire process and how you can bridge that. Perfect. The name is also perfect, the vitamin bridge. So, Martha, tell me, how apart from this, you also need to create awareness, right? So, do you go to communities? Do you go to areas and just tell them that you need to take these vitamins? If there is anybody you can reach so and so person or reach so and so health center. So, do you also go around doing that kind of awareness campaign?
So the way we are really accomplishing our mission is through donation of vitamins and healthy pregnancy information to organizations serving under-resourced women, women at risk of undernutrition during pregnancy. So those are they have the actual contact with the moms. We are providing these resources to be given to the moms. Research has shown that when prenatal vitamins are encouraged by a health or medical professional, the moms are more likely to follow through in taking them. So that's our preference for when they get that positive pregnancy test, for the health professional at that time to be able to give them the vitamins, give them instructions on how to take them, and information about what a healthy diet during pregnancy looks like as well. Word of mouth, public service. We would love to get information out and raise awareness so that these moms are actually taking the vitamins before they find out they're pregnant. But our focus today is on getting the vitamins to the moms at the earliest possible opportunity.
That's wonderful. And when you Do you get to hand over the bottle to the pregnant moms yourself, or is it only that you just supply it to the health center and then they do the providing? What is it?
That's correct.
I'm,
We
I'm,
provide to
I'm
the health center, and the health center gives them to the mom. The health
okay.
professionals give them to the moms.
Okay. So do you get to, obviously, there's a lot of satisfaction in doing this, but does anybody come back to you and say, how thankful or grateful they are? And sometimes it helps to make a situation where you are happy to do what you are doing when there is first-hand feedback.
That is one of the challenges with this, because we don't get to see the moms. We hear from the organizations that we donate to how grateful the moms are, how appreciative and amazed that they are that someone's investing in them and their baby, that someone cares enough to provide this 100 days of added nutrition. So, unfortunately, we don't get to see that interaction very often. Sometimes we encounter moms after the fact that will tell us stories about how much they appreciated the vitamins. But it's mostly, sometimes we get quotes that the organizations will provide to us from the moms.
Mhm.
But for the most part, our main interaction is with the organizations. And then we do hear how much they appreciate being able to do this and having this product available for the women that they're serving.
That's cool. And is there a selection process for these partner organizations?
We have an application agreement that any organization that wants to participate in our program has to complete and fill out. We require to know information about the organization. They have to be a nonprofit as well. We only donate to other nonprofits. They have to be serving the population that we're trying to reach, these vulnerable women who do not have the resources to go purchase the vitamins themselves, or that are going to be applying for Medicaid, that type of target population that we're trying to serve. They have to agree to handle the vitamins well, to not sell them. This is a donated product for donation to under-resourced women. So we do have a screening process. We have a lot more demand than we are able to meet. So we actually are a grant maker, but the grants that we make are in the form of prenatal vitamins. So organizations apply for us. They tell us how many women they're serving, what their need is, and then we set the quantity for the year that they're going to be able to receive. And demand, as I mentioned, is far
Is
greater than we have the capacity today. We've hit 100,000, but we could probably do another 100,000 this year if we had the financial resources to purchase that many vitamins.
And talking of if you had the financial resources, what other support do you require?
Pardon me?
What other support do you require? If there's somebody who's listening to this podcast wanting to help you, or in terms of supply, in terms of whatever else, what kind of support do you think is the most pressing right now?
So we have a variety of ways that organizations can help, or that individuals can help. We need volunteers. We're located in Dallas, Fort Worth, and we deliver vitamins to our area ourselves. So we have a team of volunteers that each month make deliveries within a fairly large geographic region in North Texas. Beyond North Texas, we ship through UPS. And so we also have need for volunteers to help pack vitamins and work that shipping process, to get the word out, to follow us on Instagram, Facebook, LinkedIn, those kind of things, to just spread the story and what we're trying to do. That's really valuable as well.
Very valuable in this day and time for people to know what you are doing, and that's what we are doing here. We're trying to share your story so more people get to know about you. Well, Martha, thank you so much for talking to us. You are doing wonderful work, and I'm sure you have the blessings of the mother and the soul that is coming into this world.